Hello, my name is Ali Musa. I'm a pharmacist by professional and a Kazura student. Now I'm doing drug discovery, development, and commercialization, a course given by Sir William S. Etwater. First of all, I would like to welcome you all in the presentation of the Life Cycle Strategic Plan, and my drug of choice is Claritin. A life cycle strategic plan is a document which composites all the discipline to ensure a successful product. It includes the following points: a market assessment for medical unmet needs, the product description, preclinical pharmacology, clinical development strategy, regulatory strategy, intellectual property, which include the patent and the freedom to operate, manufacturing strategy, the timeline, commercialization strategy, and finally, the sale strategy. Now, let us look on through each point of the life cycle strategic plan. The first point is the market. A market is a place of business by which a product are sold. In our case of pharmaceuticals, when the product, Claritin, was introduced to the market, there were many products acting on the same way, but the company which launched the Claritin was aware of this issue and have the way to over-challenge it. As other pharmaceutical products, Claritin has its limitation, and these limitations we are called them a medical unmet needs. Among those medical unmet needs is the endo, which could be only treat the endo allergies. So the company dig out and produce another pharmaceutical product called Clarinex in order to collect and to make the broad indication for this product. The Clarinex could treat the both indoors and outdoors allergies. In the market side opportunity, this product have a broad market opportunities such as commercial insurance, pharmacy benefit management companies, government entities, and others. All of them shows the desire and tend to provide non-prescription drugs. So these shareholders shows the interest in buying the Claritin. The benchmarking analysis, which is a comparative analysis, we can see that during the time of launch of the Claritin, the market was already full with other antihistamine products. These products such as Zyrtec, produced by Pfizer, Allegra, produced by Sanofi Aventis, and others. So at that time, the market was saturated. But the goodness of Claritin was the non-sedative antihistamine drug. Even though the market was saturated, the Sketching Plough, a company which produced the Claritin, brought a new drug that shows a good pharmacological results in the management of allergies. As the competitive landscape, the competition was too high because of the other companies which are manufacturing the same antihistamine as Claritin. And those companies which competing on the same market as Claritin, as I mentioned earlier, such as Pfizer, which produce Zyrtec, which is cetirizine, Sanofi Aventis produce Allegra, which is fexofenadine. Cipla produce Reactine, which is cetirizine, and Sketching Plough produce Claritin, which is loratadine. So all of these companies produce antihistamine products, and all these companies are competing at the same markets. So this makes the competition is very high on the market. Okay, for better understanding the burden of the disease, let me explain this shortly in terms of figures. According to the references, allergies affect about 40% of the population. And the allergic rhinitis is the most of the common type of allergic, which affect 10 to 20% of the population. Studies and research show that this prevalence is increasing daily. In the United States alone, have about 50 million people affected by allergies. These allergies are associated with significant impairment of quality of life, sleeping, and work performance.